Hi there, Lucy. My name is Jacob Ewell, and I will be your nurse practitioner student for today.
Great.
All right, so today we are doing a physical assessment, just the first portion of it with Lucy Ewell. She's a 25-year-old white female. Before I begin the exam, I'm going to perform hand hygiene. As I look at Lucy, she doesn't appear to be in any distress. She seems relaxed, is well groomed, and makes good eye contact with me. And then I'm just going to do an assessment of your skin to start off. So I'm just noting her skin here. She's got, she doesn't have any abrasions. There's no other lesions present. There's some mild acne, but nothing too bad. Let me just see your hands here. Okay, as I touch your hands, I'm noting the temperature is warm. I'm just going to test your skin turgor. She has good skin turgor. Her skin is warm pink, appropriate for her ethnicity. No other real abnormalities noted or abnormal looking nevi from what I can see here. And then I'm just going to inspect your scalp and your head next. So as I look at her head, I'm just going to touch and palpate. She's got normal skull contour and shape. There's no apparent hair loss. And then I just want you to do a couple things for me. Can you smile for me? Okay. And then shore up your eyebrows. Good. As I look at her face, I don't know that there's any asymmetry. It's all symmetrical. No itosis, no facial droops, no paralysis of any kind noted on her face. All symmetrical movements. So now I'm going to inspect your eyes, and I'm just going to look at the external portion first. As I look at her eyes, they're the same size, shape. There's no abnormalities with her eyelids. I'm just going to look at your pupils briefly. So just look straight ahead at my nose here. Okay, and as I look at her eyes, there's no, her pupils are brisk, equal, and accommodating to light. Her sclera is, the vessels there are slightly red, but nothing too bad. And then I'm just going to look now into the center of your eye here. So I'm just going to get in close here. Okay. And as I look into her eye, I can see blood vessels there. I was unable to observe the optic nerve. She did have a positive red eye reflex. And then I'm now going to have you follow my finger, and I just want you to follow it everywhere it goes. Good. So her eye movements are all normal. She's able to look in all directions. And then, let's see, as I was doing all of that, obviously I dimmed the lights beforehand so that you could see it well, so I could look into your eyes and see everything correctly. And then let's see, I already visualized your eyes. I looked at the optic, I couldn't see the optic nerve. And then I'm going to inspect your ears next, okay? So we'll do this ear close to the camera for everyone to see. So as I look at the outside portion of her ear, there's no abnormalities there. It's structurally sound. The pinna, the tragus is all intact. As I go to inspect her inner ear, I observe that there's no fluid, erythema, or inflammation of any kind. And I will pull her ear back and up. Okay, and as I look into the ear, okay, I can visualize the ear canal. There's some slight cerumen in there, and then there's, as I visualize the eardrum, I didn't note any There was some scarring there, which you had mentioned before from when you were young. And then there was a positive light reflex, and the appearance of the eardrum was opaque in color. All right, so now we're going to assess your nose. So as I look, I'm just going to turn the slide on again. I want you to tilt your head back and look up towards the sky. So I'm just going to look into your nose there. Okay, and as I look at her nose, there's no septal defect. It's symmetrical on both sides. There's no bony prominences noted. And you can tilt your head back down. And as I look at the structure of her nose on the outside, same, it's all very symmetrical. No signs of any injury or obstruction there. So now I'm going to just take a look at your mouth. So I need you to, as I look at her mouth here, I can see that her lips are symmetrical. They're pink in color. They look well moisturized. I'm going to have you open your mouth for me. Good. And so as I look in your mouth, I want you to just keep your tongue inside for just a moment here. There you go. Show me those teeth. Okay. Her teeth are white. Appears to have good dental care. And then go Okay. And as I look in her mouth, I can see her tongue is pink. I can visualize the uvula, the hard palate, and the soft palate are all pink. No abnormalities there. And then I can also visualize her tonsils, which are not inflamed, and you can put your tongue back inside. Thank you. Okay. And then any problems eating or chewing? Okay. And as I watched her move her mouth, there's no jaw dysfunction. And then now I'm just going to inspect some of your neck. And then I'm going to assess as well for the different lymph nodes, the 9 different lymph nodes on your face, your neck, under your chin, and behind your ears and on your neck there. Okay? So I'm just going to palpate here. There doesn't appear to be any, no hard nodules. And the lymph nodes are all normal. Okay. And then I'm just going to go behind the ears here. Again, there's no nodules or noted inflammation. And then along the clavicles, same. And then I'm going to come around to the side here to feel along the back of her neck. Okay. So now I need you to swallow for me. Good. So as she swallowed, I was feeling her thyroid, which appeared to be normal, no enlarged thyroid or nodules noted there. And then I'm just going to inspect from the front. Can you swallow again for me? Good, and I can see the thyroid moving. And there doesn't appear to be any nodules or inflammation. And the last thing I need you to do, we're just going to look at your neck. So I need you to tilt your head down to your chest. Okay, and then tilt your head all the way back. Good, and then move from side to side. Okay, all right, and so as she did that, I was noting there was no issues with flexion or extension of her neck, and then normal rotation of her neck. Is there any pain involved? Okay. All right. Thank you for watching my assessment, and thank you for my lovely patient.